Coping with change is difficult, and the changes that come later in life can be especially challenging. It's tough to face the loss of health, home, and independence, but there are plenty of ways to help ease these transitions by planning ahead and talking honestly with your loved ones and getting the support that you need. I'm joined this morning by Martha Brown, founder of Geriatric Care Management Services, as well as Marketing Director Benjamin Brown-Rodriquez. So good morning. Thanks so much for coming on this morning.
Good morning.
Martha, tell us first of all how you became involved with elder care and more about what you do.
Actually, I've always been interested in older people and found them very interesting and started doing volunteer work in junior high school. And then I got my master's degree in gerontological social work in 1976. And in that time, it was considered a very new field. There were only 5 of us graduating with that specialty.
So you've been involved in this for a while then?
Yes,
for many years.
Quite a long time.
And also, Benjamin, you've been involved with elder care management from a very young age, and you've created the Silver Runner.
Yes,
Tell us about that.
The Silver Runner is a transportation service that I started as a division of my mom's company, which is the Geriatric Care Management. I graduated from Lake Forest College in 2008 with my degree in business. And in coming back, I was going to help my mom expand and grow her company and look at different services that we might be able to provide. And I quickly learned that at the national level, one of the biggest issues for seniors is transportation. And especially here in New Mexico, as most people know, we're a little bit behind the times with public transportation, so it's even more difficult for our seniors to get around to where they need to go. So the Silver Runner is a transportation service that was founded in 2009 to help those individuals not only get to doctor's appointments and those type of things that they need to get to, but also to be able to access the community with the ease and the freedom that they felt while they drove, while driving.
Yeah, and I imagine that would be a hard thing to do because that is freedom whenever you're able to drive and get to where you need to go, and then when it comes to the point that you can't, then that it can become a burden on, or you feel like it could become a burden, I'm sure, on relatives or friends. And so what a great thing that you offer. Now, Martha, getting back to geriatric care management, tell us about that. What exactly is it?
Well, geriatric care managers are professionals that specialize in really knowing about the aging population, and usually it tends to be people like myself that are social workers or gerontologists, nurses, sometimes counselors, psychologists get into this area. So it can be a large group of people, but really focused on knowing about the needs of older people.
Okay, now how is that different than a case manager or with a hospital, clinic, or one of the Medicaid waiver programs? How is it different?
It's different because geriatric care managers are really client-centered. And we look at what the needs of the older person is, and we have the ability to go to wherever they are. Case managers that work in hospitals or for the Medicaid waivers or any number of other settings are really system driven. So it's more where they're working. So if they're working at one of the HMOs or for a Medicaid program or a hospital clinic, then what they do is they're coordinating care and looking at the needs of older people, but within their job description and within their setting of the organization.
Okay, so you go kind of outside that then.
Right, so that we're focused on families or hiring our services or involving care managers to look at their specific needs. So what the older person's needing, looking at that very comprehensively, and then coordinating and making recommendations.
Okay, now is there a professional organization or association that credentials geriatric care managers?
Actually there is. Like a person can call themselves a care manager or a geriatric care manager without having a credential. And so we recommend to the consumers through our national organization of professional geriatric care managers that a person looking for that sort of help asks if the person is a certified credentialed care manager. And through the National Association of Professional Geriatric Care Managers, there are different types of certifications for social workers, nurses, or other disciplines. So if somebody's looking to engage services of a geriatric care manager, we recommend they ask, are they certified?
Yeah, you want them to be credentialed.
Right.
And so what are some of the benefits of working with geriatric care a geriatric care manager?
Well, as I was mentioning, we're very client-centered. So what we see is that families, sometimes there's a large family, and everybody has a view of what mom or dad needs, so they all have a different view. And what we do is to problem solve, to sit down with the family and or the elders. Sometimes it starts out the adult children are coming into our office or meeting on conference phone call, and then we will go out to the elder's home to really do a comprehensive assessment of what the needs are. So we look at not only day-to-day needs like grocery shopping, cooking, transportation, how do they get to appointments, but also the legal aspect. What about healthcare decision making? Who are their powers of attorney? So a very comprehensive
all kinds
view.
of services, and then also programs too that you have here, just in case program, discount programs, and all of that. And of course they can get in touch with you, and I'm sure you have a website, and you can get more information on that as well. Now, is there a cost is a cost involved getting a geriatric care manager? What are we looking at here, or insurance?
Well, from a national perspective, different geriatric care management companies have different funding sources or no additional funding sources. Typically, Medicare does not cover care management, geriatric care management. Some programs have a sliding fee scale. Some are contracted across the country with Medicaid programs or other contracts that will help subsidize, but in general it's all private pay, and it can range in cost from maybe $50 an hour nationally to $150 an hour. Okay,
and of course I'm sure more people and our viewers will want to get more information on that. What great services you guys offer. Here's the contact information: 2403 San Mateo Northeast, Suite W26, and that's in Albuquerque. You can call 505-897-3009, and of course that website, mbgcm.com. And if you missed information here, we do have it on our website, casa.com. Thanks again so much for coming in this morning. It's wonderful what you guys are doing.
It's a pleasure.